Right, so, well, first of all, thank you so much for coming near and far in Canada and Indonesia. I think you broke the record. Indonesia broke the record, huh? Yeah. I was talking to her outside, and she walked up. She goes, Dr. A, I just flew in from Indonesia just to hear you talk. Amazing, right? Yes, so thank you very much. Change. What someone tells you about this, I mean, you can talk to 50 patients here, more maybe later, and what anybody tells you about this, it is 10x. It's the way you feel. I mean, it is a no-brainer. It's something that you can pay up front for it. You can finance it. You can find the way to pay for this. But let me tell you this. The money is nothing compared to the way you feel. Nothing. Just in food. Savings in food, 8 months pays for your surgery. So it really is an investment that comes back to you. But that's not the money. The money isn't the issue here. It's how you will feel, which is just out of this world. You have no idea. I've been doing this procedure that I did a big bet on it. Back in 2005, 2006, I learned this procedure in France by the gentleman that invented the procedure itself. That's Professor Michel Gagnier. That I see him every meeting I go to. I see him 3 or 4 times a year. And I wasn't aware of how much this procedure could do. It was just a simple technique I learned in France. I saw it. I said it's reproducible, easy to do in Mexico, and came back. And once I was fired up. I came back to Mexico, and I said I want to change some lives. I want to do this procedure, but nobody wanted to. Nobody wanted to because 2005, 2006, this procedure, you would type in Google, gastric sleeve, nothing would show up. Nothing. So I started to get some information. I would tell patients about the procedure. Back then, lap band was like the bomb, and the makers of the bands, Johnson & Johnson and Intimate Healthcare, were promoting the band big time because there's a lot of money involved into pharmaceutical companies, all this stuff. But so people wanted the band, and when I told them about the sleeve, they're like, "You're going to cut what of my stomach? How much of my stomach? No, that's butchering, no way." So it really sounded like really drastic. So the only people who really wanted the sleeve back in the old days, 12 years ago, were people that were failed lap bands or failed previous procedures and were looking into another option. But the procedure itself was not authorized. I don't know a little bit of history. It was not authorized in the States by the FDA or the ASMBS until 2009. I believe it was June 2009. So there was nothing in the States, and by the time it was authorized in 2009, we had done about 2,500 procedures already. So we were like the masters, and back in that time, I used to fly out a lot in Houston and LA and Chicago, and we would be teaching the procedure to U.S. surgeons in 2009. Right now, of course, the sleeve is very popular now. Actually, it was the last 2 years, 2015 and 2016, it was the most popular procedure done regarding weight loss surgeries. That's a little bit about me. I started doing the procedure back in 2005, 2006. We've done over 11,500 of these. This is what we do every single day, several times a day. And I've written 5 books on the subject, several articles. I do speaking at some international conferences, but my favorite is this. My favorite is patients. Because I am very, very committed to patients with information. In 2006, when I started doing the procedure, as I was telling you, Google didn't even have the information I had. So by 2008, I decided to write a book for patients. The more information out there, and I can't be very specific and tell you, if you want to be my patient, I'll give you this USB drive and you go see it on your own. No. Most of you know I am very open with my information. I have a YouTube show. I got the AskDrA show that we transmit on YouTube every week. And now it's a fan page on Facebook, and got the books available. I got all my information available. Yes, when you become my patient, you only have certain information that's yours. That's our guidelines, the way we manage our patients, but the information is out there. Okay, so why weight loss surgery? And you can probably think, well, you know what, this weight issue is probably manageable. I can do diet and exercise, or I'm just tired of doing diet and exercise, or maybe it's just not for me. The diet and exercise is not for me, or maybe weight loss surgery is just not for me. Well, the thing is, everything that we are doing right now is very, very well studied. This is something that gets studied all the time, continuously studied. We are currently running studies, and we don't stop. So there's a lot of information, and what I'm about to tell you is very well proven. And bariatric surgery is a cutoff from is this a laser? Yeah, it's a laser. So all the way up here, you got the ASMBS logo. That's the American Society of Metabolic Bariatric Surgery. That is the most important organism in the United States regarding weight loss surgery. And they state that weight loss surgery is the most important, the most effective method treating weight loss, and of course certain comorbidities like diabetes and high blood pressure and cholesterol and triglycerides, etc. Even though people, friends and family tell you, damn, you look good. What the hell are you doing, huh? And you're like, first, should I tell them? Shouldn't die. I'm doing this diet. I'm working out with a personal trainer now. And until it gets to a point that you can't hide losing 50 pounds or 60 pounds or 100 pounds. Or somebody yesterday told me lost 140 pounds. Chuck?
175.
175 pounds down. Yeah. Stand up just for a second, Chuck. Look at him. If you see it, yeah? If you've met him outside, you would never even think. You were initially how?
351 pounds.
300. So now, this is what I'm going to be talking about on the seminar right here is technical aspects. It's the surgery. It is this is the procedure. This is where you start. This is what to expect. This is what it does. This is a tool. Later on tonight at the patient reunion that everybody's invited, patients and non-patients. You're welcome to stay because we have a ball, by the way. And we're going to be talking about, we have a guest speaker. She's going to be talking about food addictions. I'll be doing a motivational talk, talking about better food choices, and something just to help you keep on track. Just keep it there, keep focused, because the more you work with this tool, the better results you get. And it's amazing. I mean, the sky's the limit. It's how much you work with this procedure. And then, like most things in medicine, we started doing the procedure, as I was telling you, 2005, 2006, and our goal, of course, was to make you lose weight so you can feel good about you and your body and the quality of life. And all of a sudden we started to notice that diabetes started to go away in these patients. We had no clue. And then high blood pressure goes away, and cholesterol goes away, and the sleep apnea goes away, and you don't have to sleep with that Darth Vader machine anymore, and stuff like that. So we started studying why diabetes would go away. I mean, we knew certain metabolic issues, diabetes and high blood pressure, were related to weight, but we didn't know why and why it was reversed. And we started to notice that certain procedures did have an anti-metabolic effect. The gastric bypass is one of them, and of course the sleeve is the other. These procedures are known to have an anti-diabetic effect, and for people who are not diabetic and get the surgery, well, look at it as a little help, like a vaccine of trying to avoid diabetes down the road. People who are diabetic and have less than 10 years of being diabetic and are not on insulin, they have a good chance of dropping and just being like cancer-free, you know. Once you get cancer, you're never, ever cancer-free. You always get screened forever and ever. But here, if you draw some blood, diabetes will not be detectable. So that means your blood glucose is good and everything gets better. So it's a very, very good advantage. Now, people who are on insulin, people who have more than 10 years, what happens? Will it go away? Well, probably not, but in every single case, it gets better. It gets better. So probably you'll drop from doing insulin shots back to oral medications. It's a good deal. All right, this is also from the American Society of Metabolic and Bariatric Surgery, and this is a whole bunch of stuff that is directly related to being obese. Diabetes and high blood pressure and your knee pain, your back pain, and your venous insufficiency, and well, everything that is related to being overweight. But by having weight loss surgery, look at the percentages of resolution, of being better, of getting better. It is really, really good. And see, type 2 diabetes over here, 83% resolved. Metabolic syndrome, 80%. Heartburn, stress, gout, but the most important thing is these two on the bottom. Mortality, everybody has a mortality here. Because if you smoke, because of your family history, because of the weight you have, because of your habits that you have, every single one of us will have a certain percentage to die in the next 5 to 10 years. If you smoke, higher percentage. If you don't exercise, higher percentage. If you eat bad, higher percentage, so on and so forth. So by having this surgery, you have a reduction, 89% reduction in 5-year mortality by having this procedure done. And the most important thing, key, as I told you a few minutes ago, is quality of life improved 95% of the patients. That is what's priceless. That is what's priceless. So this procedure does involve removing 60 to 80%, 85% of your stomach. I know it sounds really, really drastic, but look at it this way. It isn't. It's a procedure that I do in 25 minutes. It is a procedure that is done laparoscopically, tiny incisions. Your recovery is really quick, and it doesn't feel like you just had 80% of your stomach removed, because it's like getting your appendix out. Or getting your gallbladder out. You don't notice that something is really missing in there, but you will notice that you can't eat that much food anymore, that you will notice. So this procedure, it has a big advantages over any other procedure. That is why this procedure is so popular. Remember, 2015, 2016, the most popular procedure by this ASMBS published. This procedure, it didn't take us 25 minutes to do. Right now, we have a staff I have a staff about 28 staff members, including doctors and surgeons and nurses and everybody knows their precise part of what I call the perfect recipe. It is the same staff over and over again every single day, several times a day. So it's like an orchestra, you know? It's like an orchestra. If you bring the Berlin Orchestra and they do one melody every single day, several times a day, without changing the guys at the drums and at the flute and everything, believe me, it will be magical. And that's what I truly believe in it, and it is magical. I really am proud of my team. It's great, and the way it turns out and the results we get, it's because we do it every single day. So I decided to drop every other procedure, lap band, gastric bypass, and everything, that it could have brought me extra income or other procedures, but focusing on one procedure gives you, the patient, the best results. And this is the part of the stomach that stays behind with the patient. If you notice, the entrance of the stomach is the one you were born with. There's no changing anything there. The exit of the stomach, here's a very important valve called pylorus, and it's It was designed by God, placed in you, and it has a purpose. In a gastric bypass, the name says it, you bypass that valve. And the results are very different just because you're skipping that valve. Makes a world of difference. That is a natural valve. It is there for a reason, because after that we have some bile and some pancreatic juices and mixes with digestion with fluid and everything, and this is the first portion of the intestine. Now the intestine is not touched at all, so the absorption of nutrients is 100%. Doesn't happen with a bypass as well. So there's a lot of advantages on this procedure versus any other out there. That's why I truly believe in this procedure. I did my mom's surgery. I can tell you that. All right. So if I did my mom's surgery, this is what I did on my mom. Believe me, I am convinced that this procedure is the best thing you can do. All right. So you may recall that stinky pre-op diet. Sucks.
Yeah.
All right. It's not because Dr. Alvarez wants to, huh?
3 weeks.
3 weeks. Who did it for 4 weeks? 4 weeks. 4 weeks. More than 4 weeks. Brandy?
Yes. 30 days.
Okay, 30 days. Yeah. The longest a patient of mine has done the pre-op diet is 8 weeks. Yeah, it's not because I'm a pain in the butt and I just want to give them a hard time. No, it has a reason. That's why I wanted to remind you. This slide right here, the silhouette right here is his liver, and in normal situations, which is here, covers only the upper part of the stomach, right, that you see right there. When I do the procedure, well, I have to manipulate all the way up here, and the liver, I wish it was that size, but it isn't. In a patient that's overweight, you have what we call a fatty liver. Medical terms, non-alcoholic fatty liver. Anyway, this liver covers, not this portion, covers all the way over here. All the way over here. So, I do not have access to the full stomach. So I need to get the patient to get prepared, shrink the liver, shrink enough to have access to the stomach, and in other words, just, become small, accessible, because we're doing it laparoscopically. If we would do it open, big cut down the center, probably it wouldn't matter that much because I could manipulate it with my hands and just move it to a side and do surgery. But since we're doing it with tiny little instruments and the little camera that goes right underneath that liver, and if it's heavy and I don't have access, that is the main reason that I have you do that pre-op diet. This is, I promised you, Nina, see? So this is Tyler. This gentleman right here is Tyler. This is Nina's son. All right. So this is just a little video that can explain of what to expect after surgery. Will I be in pain? Will it hurt? Will I be screaming in pain, or can I move around, or when can I get up to the restroom on my own? Or this video explains it all. Tim, can you just play the video, please? So this is Tyler. Watch. 24 hours after surgery. He's a salsa dancer. All right. He's an instructor, and he's with 3 other patients. He's teaching them to salsa dance on the hallway. Huh? They're having fun. 24 hours after surgery. Look at them. Pretty cool, huh? Yeah. So yeah, since it's done laparoscopically, the procedure, really recovery time is really, really quick. You're getting up to the restroom on your own 2-3 hours after surgery. And next day, you're up and going. So recovery is really, really quick, thanks to laparoscopic surgery. You want to look into this video a little bit more? I placed the website down here, salsaaftersurgery.com. That was Nina's idea. I like it. What about laparoscopic surgery? Well, laparoscopic surgery, or also known as keyhole surgery, tiny incisions on your abdomen. We go there with some ports and tiny instruments, as I was mentioning. These incisions are the actual ones that we currently do. These, of course, are enlarged, like I was going to say, like you see on the cereals, enlarged to show texture. These are enlarged for you to see, but the measurement is in millimeters. All right, so very, very small. Actual size down the road, you can barely see them. This is taken 8 months after surgery. Tiny incision over here, tiny incision over here. There's another one over here. And you can barely see them. So why this procedure over any other? As I was telling you, I mean, this procedure has many, many advantages over whatever procedure you throw out there. Lap band, if you're on Snapchat following me, believe me, I take out those things left and right every single week. Why? Because it's a foreign body that doesn't belong in you. It's a foreign body that you were not born with, and sooner or later, believe me, that body of yours will find a way to get rid of it. So we remove those bands quite frequently in the OR. So it's a procedure that does not give good results down the road. It's a procedure that does involve a foreign body, as I was telling you. It involves maintenance, which is a pain in the butt, because you need to fill that band with some saline to get a good fill and feel restricted. And if it's too much, you'll be puking like crazy, and you're rushing back to the OR. I mean, to your doctor to get it unfilled, or to the ER. And it's just a give and take situation for years until you get tired and you get that band out. Remember, with the sleeve, there is no foreign body. There are some staples. Those staples are titanium made. Why titanium? Because titanium is the only material known to mankind which is 100% biocompatible. So all those hands that of people that had surgery have staples, titanium staples inside of them. If I'm not telling them that, if they didn't do enough research, they wouldn't even know down the road forever and ever. Why? Because the titanium will not give you any issues down the road. There is no allergies to titanium in human beings. That is why the hip replacements and knee replacements and everything is made out of titanium now. But the amount of titanium used for these micro staples is minimum. Will you sound the alarms at airports? Unfortunately, you won't. So you can put your mind at ease that once you cross through TSA, you won't beep. So no, metal detectors won't be detecting those titanium staples. You can get MRIs. It will not interfere at all down the road with your lifestyle. These staples, what they are designed to do is to hold your stomach side by side for 15-21 days. That's enough time for your stomach to heal. Once your stomach has healed, that's it. Staples are useless. But it is very, very, I would make more damage to go back and take those micro staples than to leave them in there. That is why they're made out of titanium. So who's a candidate for this type of procedure? It all depends on a magic number called BMI, body mass index. What is the BMI? Well, the body mass index is a number that we get with your height and your weight, and I'll talk a little bit about that in a minute. So if your BMI, if you're more than 100 pounds overweight, right from the get-go, you're a candidate. All right? I don't care if you have diabetes or high blood pressure or sleep apnea, or you didn't, or you used to. If you're 100 pounds overweight, you're a candidate. If your BMI, body mass index, is over 40, you're a candidate also. But if you have diabetes and high blood pressure or some other medical conditions related to being overweight, you don't have to be that big to be a candidate for weight loss surgery. Your BMI can be 30 and still be eligible to be a candidate for this type of surgery. And of course, most of the patients have been overweight for over 5 years and just can't seem to get the weight off. If you go to endobmi.com down here, it'll take you directly to my page, where you'll find this calculator. It'll tell you your BMI. All right, so enough of the talking. I'll just show you a little bit of my patients. These are some before and after pictures. My team and I, Nina included, Susan, Brandy, and Ellie, and Lula, and my staff in my office. I'm sometimes very OCD with some stuff, and I wanted to put together the most amazing and impressive amounts of before and after pictures only on the gastric sleeve, and we have them on my website. I think it's in one site the most you can find. We have over 400 before and after pictures. We've got video testimonials. We've got medical professionals from the States, Canada, locally in Mexico that come to us for surgery, and you'll find all that on my website. So this is Tyler. Salsa lessons. He shrunk even more from here, right, Nana?
Yeah, he's down 100 pounds.
100 pounds. Century Club. Who's a Century Club here? So for those who don't know, we came up with these really cool shirts called Century Club shirts. And Ellie back there designed them. And people who get to 100 pounds lost, we call them Century Club. Oh, Yvonne. Where's Yvonne? I love Yvonne. Your star sleever, Yvonne. You have to be there. All right, we got Anthony here. Anthony lost 140 pounds in 8 months. So he was a big boy. He was close to 600 pounds when we did his surgery. Keisha, 100 pounds in 5 months. This is a local doctor, Dr. Chapa. He actually crossed, that's my office, with that door behind him. He crossed the door and he said, I go, what's up, doctor? How you doing? You want to lose some weight? He goes, the hell with it, weight. Get rid of my diabetes. I'm tired of my diabetes. So he had surgery just to get his diabetes under control, which he did really good. And he's been off diabetes medications ever since. This is Amy. She's a patient of mine from Miami Beach. Who's from Miami? Nobody? We have Florida, right? Very good. So, well, you know about this. Everything in Miami is beaches, bikinis, and beautiful señoritas. Right? So Amy here, she did really good. Before and after, vast majority of my patients get to this point, they are thrilled. But Amy here wasn't. All right. So Amy wanted to lose 15 more pounds from here. And I coached her with some stuff, doing a low-carb diet that we'll talk a little bit about that later on tonight. And exercise activity. She would do elliptical training on an elliptical machine 4 times a week, and in 2 months came down her 15 pounds. Why? Because you have your tool. Because you have your tool. That tool will always be in you. So sooner or later you jump off the wagon, you fall off the wagon, you want to get back on track, you can. It's always possible. All right, this guy, David's really a good guy. This is David Scott. You've seen this guy, right? Stifler for the American Pie movies, right? You have to, Stifler. Huh? So Dukes of Hazzard as well. Well, this guy's an actor, and this is his brother. And David contacted us because he had an issue. A psychologist actually diagnosed him with a major depression because 2 brothers, one of them a movie star, the famous one, the guy with the chicks, the guy with the movie contracts and all this stuff, and he's also in Beverly Hills as a golf instructor. Right, so he does golf, and he had major depression, and he got cleared by his psychologist. He sent it over and arrived with us. And David did really good, and we became good friends. We talk every so often, and I think he actually got recently a contract for a movie with his brother now. So, how about you? When do you want to do your before and after? Because it all takes a step. As I told you, and I was talking a few minutes before we started, this is an option. This is a really good option. I'm not telling you to take the step for surgery. If you want to, we can help you. Does it work? It rocks. Do we have experience? Oh yeah, this is my passion, all right? And it works fantastic. It levels things off. It makes it so much easier because throughout life, a lot of patients are just struggling every single day. What am I going to wear? What am I going to do? Where am I going to shop? Will I look good? It just goes on and on. So this levels off. It levels things off. It makes life so much easier. You got a tool to help you always, and it is a very, very effective tool. All right, so if you want to fill out those health history forms, believe me, those health history forms, something I am, again, OCD, is you will not be screened by anybody else from my staff, any other doctor, but me. I screen absolutely everybody that wants to have surgery with me. It's a little trick I do. Let me tell you why. And on my website, I am, anybody know what Surgeon of Excellence is? No? Yeah? All right, so Surgeon of Excellence is a really big thing in the weight loss surgery world. It's in North Carolina. Raleigh. Surgical Review Corporation is, that's where they're based. Surgical Review Corporation analyzes and they analyze everything. Analyzes the hospital, your charts, files, complication rates, volume, how many surgeries you do, your results, the outcomes, and then certifications, and then they check on your credentials and make sure you're updated and all the conferences you attend, and if you're an international speaker and all this stuff. And once they are done after 2 years analyzing all this stuff, they give you a little seal, bing, on the website. It says Surgeon of Excellence. So it's a very big deal. So a little trick I do is I select patients. That's why I screen them as well. Because if I take you as a patient, if I say you are a good candidate to come to our center, I am sure you're going to do fantastic. You're going to do really, really good. I tell patients, when you get patients get to the meet and greet, I tell them, you know, I'm happy you're here. I'm thankful. The whole team is very happy that you're here and that you chose us as the team. And initially, you choose me, which I'm thankful, honored, but then I choose you. So out of those health histories that come in, I do reject some patients that try to come to our center. The way we do this is, well, it keeps our numbers really clean, it keeps our statistics really high, our outcomes way, way, way above literature levels and what to expect, so our results are really good. So I screen patients myself. If you fill out a health history, which of course is free, and I'll review your health history for free, and I will send you a personal video. Who got a video from me? Look at that. Love it. All right. So I love doing my videos. So wherever I am around the world, I will open my laptop, airport or home or office or in the OR. I'll open the laptop, I'll review health histories, and I'll send you a shout out, send you a video with your personal stuff. Okay, this is your height, this is your weight, this is your age, this is your profile, this is what you expect. If you got diabetes, I think this is going to help you, this is going to you're going to drop this medication, so on and so forth. So I analyze every single health history that is submitted to our group. So if you want to sign up for a health history, just let Susan know, and it'll be a pleasure to help you out.